Now, proton pump inhibitors. These are the most widely used drug. These are the prodrugs and highly efficacious. These are safe, superior to H2 blocker, and single dose inhibits 90 to 98% of the HCl secretion. It is an ideal drug because of the short half-life, long duration of action, and concentrated and activated near the site of action. These include drugs like omeprazole, pantoprazole, lansoprazole, and esomeprazole. Now, pharmacokinetics. These can be given orally. These are all product, and there is a rapid first pass and systemic hepatic metabolism. Now, mechanism of action. It is a product which is absorbed from the intestine and rapidly enters into the parietal cell canaliculi and become protonated and concentrated in the parietal cell about more than 1000-fold and converted to the active reactive theophyllic sulfonamide cation and reacts with hydrogen potassium ATPase and forms covalent disulfide linkage, and there is irreversible inactivation leading to by hydrogen potassium ATPase enzymes, thereby blocks the final common pathway of the acid secretion. Now, clinical uses for GERD, peptic ulcer disease like duodenal ulcer, gastric ulcer, H. pylori associated ulcer in the form of triple therapy, NECID associated ulcer and prevention of the rebleeding from peptic ulcer, non-ulcer dyspepsia and prevention of the stress-related mucosal bleeding and gastrinoma. So, how PPIs promote eradication of the H. pylori infection? These increase intragastric pH, thereby reduce the MICF antimicrobial against H. pylori, and there is minor direct antimicrobial properties. Now, eradication of H. pylori or triple therapy. The aim is to heal the ulcer and eradicate the organism. Now, the 7 days regimen includes omeprazole 40 mg per day or lansoprazole 30 mg, clarithromycin 500 mg, and metronidazole 400 mg. The 14 days regimen includes omeprazole 40 mg per day or lansoprazole 30 mg, amoxicillin 1000 mg, and clarithromycin 500 mg. And after completion of the triple therapy, the proton pump inhibitors should be continued once daily for 4 to 6 weeks to ensure complete ulcer healing. So, why PPI and antimicrobial agents are given together? The proton pump inhibitors increase the intergastric pH and decreases the microbial contents of the antibiotics against Helicobacter pylori. Adverse effect: diarrhea, headache, abdominal pain, reduced vitamin B12 absorption, reduced absorption of the food-bound mineral like iron, calcium, zinc, and there is an increased risk of enteric infections. Increased risk of community-acquired respiratory infections may be seen. In case of the there is increased gastrin level, and increased proliferation of the colonic mucosa leading to hypergastrinoma. Long-term use may reduce HCl and favors colonization of the bacteria in the stomach and converts ingested nitrates to nitrosamine, which can cause gastric polyp, and carcinogenesis may be seen.